Kristen.
Hi.
Hi, Mrs. Poulin.
Good
How
morning.
are you guys?
Great.
Good.
You look different. I guess you've had your baby.
I have. Yeah, I had a little girl.
Wonderful. What's her name?
Her name is Beatrice. She's actually already 2.5 months old. It's hard to believe.
Goes fast.
It sure does. So, how's your asthma, Kristen?
It's good. Thanks to the peak flow meter plan and my meds, I haven't had to come to the emergency room or use any type of rescue medicine since my last visit.
That's great. I'm thrilled to hear you're doing so well.
Yeah.
So what brings you in today?
Well, actually, we brought you this tick I found on me yesterday.
Oh, wow. That's a nice specimen.
Yeah.
Where was it?
It's on my knee.
Huh. Was it embedded?
Yeah, I didn't want to come out.
It was really hard to get out.
Yeah.
We used the tweezers, and we think we got it all.
Looks to me like you did, actually. What I'd like to do, we have a chart in our lab of the different types of ticks, and so I'm just going to go over there and compare this to the chart and see what type of tick it is, okay?
Okay. Do you think I'll get Lyme disease?
It's a possibility. Identifying what type of tick it is what's going to help me figure out whether, what your chances are of getting Lyme disease, okay? So I'm going to zip over to the lab. I'll be right back. All right. All right, not sure how I'm going to get this little thing out of here. There we go. Okay.
This is what Alexa sees when she takes a look under the magnifying glass. A classic female deer tick.
Yep, looks like a female deer tick. That's awesome. Oop, get in there. Okay. Hi, Dr. Heyman.
Hey, how are you?
I'm good. You?
Doing well, thanks.
I've got Kristen Poulin and her mom here. Do you remember them from the hospital?
Yeah, absolutely. How are they?
They're great, actually. Kristen's asthma is doing really well. She
Good.
hasn't needed to go to the ER or anything.
That's
so,
great.
Yeah. They actually came in because Kristen found this tick on her leg yesterday.
Oh, wow.
They brought it in for us to see.
Wow. Have you identified it yet?
I did, actually. It looks to me like it's a female Lyme tick.
Okay, great. It's really important to do that step in things. Does Kristen have any signs or symptoms that make you worried she may have Lyme disease?
You know, I got so excited about identifying the tick, I haven't examined her yet.
Okay. Well, after you're done with that, we'll get together and we'll figure out how to approach a patient who presumably is asymptomatic but may be at risk for having acquired Lyme disease.
Okay.
Okay.
All right, I'll go check her out and be back.
Great.
Thanks.
In the meantime, I can give you some background information on Lyme disease. A bacteria by the name of Borrelia burgdorferi is the responsible culprit for Lyme disease. The constellation of symptoms that we know today as Lyme disease have been around for centuries and were actually first described in Europe. It wasn't until 1970 that we had our first case in the U.S. that could be traced with certainty to an infection that was acquired on a grouse hunting trip in Wisconsin. It was later in the 1970s that we had epidemiologic and clustering data that came out of the New England states. The term Lyme disease was coined, and the rest is history. Now, one of the interesting things about Borrelia is that it relies on a vector, which is an animal that doesn't become ill carrying the bacteria, but whose job it is to transfer the bacteria to the susceptible hosts. In the case of Borrelia, the hosts would be deer and humans, and the vector or transporter is the deer tick, known as Ioxides. Now, what happens with the deer tick during a certain part of its life cycle is it takes a blood meal from an affected host, in this case a deer. It then transfers some of the bacteria to the unaffected host, or the human, during its next meal. One of the amazing things about the deer tick, as you'll see in the following diagram, is that it only needs to take a single blood meal every year.
The deer tick's life cycle requires at least 2 years to complete. Each consecutive stage of the deer tick, larva, nymph, and adult, feeds only once. Larvae feed on small mammals, particularly mice and birds, in the summer and early autumn. Then they become dormant for the winter until the following spring, when they molt into nymphs. The nymphs then feed on small mammals such as mice and chipmunks, but they may also feed on larger mammals, including humans. Nymphs subsequently molt into adults. The adult ticks feed and mate on larger animals, particularly deer, in the fall and early spring. Engorged female ticks drop off these animals and lay their eggs on the ground, completing the life cycle. Most cases of Lyme disease are transmitted to humans during the spring and the summer by the nymphs.
50 to 80% of ticks in Maine are actually affected with Borrelia. What this means is that once you've been bitten by a tick, there's a fairly high probability that some of that bacteria could be transferred into your blood system. You could then theoretically go on to develop Lyme disease. Now, the good thing about Lyme disease is that treatment, if it started early, is very easy to do and is very efficacious. Doctors actually divide up Lyme disease into 3 stages based on the progression of symptoms. The first stage is called early localized disease. This usually happens about 2 weeks after you're bitten by a tick, but it can occur anywhere from 1 to 60 days after the initial infection. This stage is defined by a characteristic red circular rash known as erythema migrans. Now, we think that most people who get Lyme disease have some version of this rash, but unfortunately sometimes the rash goes unnoticed because it may be in the hairline, in the groin, or in the armpit where the ticks like to embed. Some people will have just this one initial area of rash around where the tick bite occurred. However, others, later in the disease, if they haven't been treated, can go on to have a series of multiple, hence the term erythema migrans, lesions throughout their entire body. This is actually part of the second stage of Lyme disease, which is called early disseminated disease. Now, the good thing about this stage is it too is very easy to treat if we catch it. Examples of early disseminated Lyme disease would include things like arthritis, which is a red swollen joint, heart block, which is a temporary disruption in the electrical activity of the heart, meningitis, or even a temporary paralysis on one side of the face. It's actually not until patients go on to the third stage of Lyme disease, which is called late disseminated disease, that they would be at risk for chronic arthritis or other neurologic problems. We know that we can prevent all of these sequelae with prompt and early diagnosis and treatment of Lyme disease. This is why Alexa and I are so concerned to figure out whether Kristen could be at risk for having early Lyme disease, so that we would treat her now and hopefully prevent Lyme disease and prevent all of these consequences down the road.
So I just examined Kristen.
Great. Any concerns?
I don't think so. I don't see any evidence of a rash. I actually examined, right where the tick bite was on her leg, and it looks, there's a little bite there, but it looks okay. The cardiac exam was normal.
Great.
And in the history, she's not complaining of any joint pain. So I think, like you said, she's asymptomatic right now.
Great. So what should we do?
Well, I was thinking about that, and I actually remember when I was down in the emergency room a couple of months ago that we did occasionally treat people with antibiotics, even though they were asymptomatic, if they brought in the tick, and we were pretty convinced that it was a deer tick. So I'd like to try that.
Great. Do you want to try to find a study that would support the use of prophylactic antibiotics in this situation?
Yeah, absolutely.
Okay.
All right, I'm going to jump on the computer.
Okay.